In order to correctly diagnose a patient, you need to gain information from the patient. First off, you need info on the present illness of the patient, when it started, any change in diet or behavior, etc. Family history is also very important. From the family's history, you can learn if there are any genetic diseases that might affect the patient, or if the patient has been in close contact with any sick people. As you may already know, whenever you visit a doctor, they examine you. This will include a physical and questions. A doctor will be able to gain valuable info about how you are doing through this examination, but sometimes a doctor will need to run tests. This is because a doctor is not always able to see how your body is doing from the inside. After going over all of this info, a doctor will be able to diagnose a patient. In this video, we will go through this case using a real-life case. A 5-year-old female presents to the primary care office for a checkup. She is accompanied by her maternal grandparents, who are also her legal guardians. The patient is in kindergarten. During the visit, the grandparents tell the doctor they are concerned about her poor weight gain. They say she eats all the time. The grandfather says she might eat a whole frozen dinner for a snack, then still eat a full cooked meal for dinner. Grandparents report a recent diagnosis of strep throat about 3 weeks ago. The child received her antibiotics and is recovered. She weighed 4.2 kilograms at birth. She did not initially pass her newborn hearing test, but did pass on the second attempt. At the age of 2, she had not yet met her language milestones and had another hearing evaluation. She was found to have bilateral hearing loss. As a result, she now has a left cochlear implant and has consistent follow-ups with speech and language services. The child has received all her required immunizations. Her height is between the 40th and 50th percentile, while her weight is between the 3rd and 6th percentile. Mother of the child, who is not involved in her care, has uncontrolled insulin-dependent diabetes. The child also has an older sibling, age 8, who lives with the maternal grandparents and is healthy. No information can be provided about the child's father or his family history. There is no known family history of hearing concerns nor of juvenile diabetes. The child's height and weight remain in the same percentiles, with a weight gain of only 1.4 kilograms in 1 year. She has a heartbeat of 122 beats per minute. The child appears to be thin and anxious, with dry lips and mucous membranes. She is noticed to have a sweet odor to her breath. Top diagnoses include failure to thrive, steroid-induced hyperglycemia, and type 1 or type 2 diabetes. Failure to thrive could be considered because of her slow weight gain. Steroid-induced hyperglycemia will not be likely in a healthy child 2 weeks after completion of antibiotics. Diabetes typically presents with symptoms of polyuria, polydipsia, and polyphagia with unexplained weight loss, making it a top diagnosis. It would be helpful to obtain a urinalysis and/or a finger stick blood glucose. Urinalysis revealed a glucose level of over 500 milligrams per deciliter with a trace of blood and ketones. These findings, along with her physical symptoms, do show a possibility of diabetes. After sharing these results with the grandparents, it was agreed that the diagnosis would be further confirmed with blood testing and an examination at the Children's Hospital. At the hospital, it was confirmed that the patient has type 1 diabetes. The family was educated about the disease and how to properly care for the child.